newbie nursicos. I am Suchetna from AIMS Bhopal Nursing College, currently at second year, and now I am going to represent the second part of the video. And at the first part, I have discussed up to family coping index, the second page actually. Mistakenly, I have not discussed about the first page, and now I am going to discuss about the first page. Actually, it was shuffled, so I couldn't discuss about that. So today I'm gonna discuss about it. The family coping index. A family coping index, that means कि how the family um, can cope with the situation, can deal with the situation. You have to analyze, you have to give remarks on that. So at first I have written name of the head of the family, date of care began and date of care ended. In the medical surgical nursing or other care plan or case study, you guys focus on the disease condition, but here we will focus on not only disease condition but also the disease condition, the relation with the disease with the family, and the disease, how the disease is affecting over the family, the practices of the family, the practices how are affecting with the environment. We will discuss about that, like not only the disease condition but also the everything like the environment, the community settings, everything we will discuss about that, and how the family is dealing with that, and we will give remarks and score according to this. So at first, the point is physical independence. The physical independence, that means how the family members can do their own work, their own activity in daily lives. ADLs can perform ADLs. So we will comment on this, we will give marks on this. There you can see the 5 rows, like 1 2 3 4 5. So at the fifth, uh, where I have written down the 5, 5 means there is no problem, and the number 1, that means there is problem. Okay, they cannot cope with that, they cannot deal with that. So in this basis we will give remarks. Like physical independence, I have given marks 5. That means all the family members can perform their activity in daily lives. And then justification, that means you have to write कि the family can do their activity in daily lives, etc. And then therapeutic competence, like if they have some problem, like a cold and cough problem, yeah, fever, how they can treat it, how if they are taking medicine from their nearby health center or not. you have to you have to give remarks and write on this, like if they have any financial issues, and if they have some beliefs, like they do not take medicines from the health center due to their lack of belief कि it cannot effective on them. you can write on this, just like I have given the marks 3, because they have some financial problem, that's why uh, sometimes they do not visit at the health center. So I have given marks 3, and also they have some belief problem ki um, health center cannot do anything for our health. So I have given marks 3, and according to your family situation, you should give marks. Okay. Then knowledge of health conditions, like in the family, if somebody is pregnant, if somebody has hypertension, if somebody has diabetes mellitus, and some problems like this, how much they have knowledge on this, like what to eat or what to avoid, what should be their daily activities, what should be um, what should eat on that time, what should do on that time, what is the healthy lifestyle. If they have any knowledge of this, according to this basis, you have to give remarks or a number on this. And then application of principles of general hygiene, like how they are maintaining their hygiene, how they are how they are dumping their wastages, how they are if they are recycling any waste products or not. You should have to give remarks on number on this. And then we will move to the, actually it was shuffled, so I at the last video I became confused, so sorry for this. And then yeah, then it was the second page. I already have discussed about that, but still I will tell about this. Like the next point is health attitudes. Like health attitude, that means how they are treating of their own health conditions. Like if they have hypertension, if they are maintaining the healthy lifestyle or not, if they are obeying their uh, doctor's advices or not, you have to give remarks on this. Then emotional competence, that means the bonding of the family, and also about the about like if you have hypertension, if your family member got hypertension, then how is his mental condition right now, you have to analyze and give remarks on this. Then family living condition, like what is the type of their house, and are they maintaining hygiene, like toilet condition, yeah, their drainage system, you have to write on this. Then physical environment, like how is the um, environment, that means how is the relationship between their neighbors, yeah, how is the environment, like it's damp is there any damp situation, or is there any um, wastewater damping in this area, yeah, the area is clean or not, you have to give remarks on this. And at last, Uses of community resources, that means you know about the asha workers, you know about the health centers, if they are taking community from medicines from the health centers or not. You have to give remarks and um, point scale on this basis. How frequent they are visiting the health center, you have to give point scales according to situation. Okay, then we are moving to the family developmental stage and task. Development stage is dissolution. There are five developmental stage. So dissolution, that means um, the head of the family now she's in the old age, and after some day, after some years, she will get die, and the new family will um, establish. Okay, so will be established. So it is called dissolution. Like dissolution, that means ki, uh, it will get destroyed and the new will get reformed. So dissolution, I have also written key aging of family members, developmental look, adjusting to reduced income, acceptance of change in old, and adjusting new family generation. Like the head of the family has to adjust with the new family members, like her daughter-in-law, like her grandsons, granddaughters. So it is the indications of dissolution of the family. Then we have to write about the health assessment and management of health problems of family members. You have to write on this identification data, just like the normal medical surgical nursing care plan. Format: name, relationship with the head of the family, age, gender, religion, education, occupation, monthly income, marital status, address. Monthly income, that means you have to write the monthly income of this particular individual, not in the whole family monthly income. You have to write the particular family member on whom you are writing about the health assessment. Okay, then personal history, habits. I have written she has had habits of chewing tobacco. So my family is head of the family, uh, who was the head of the family, she has the tendency of chewing tobacco. So I have written on this, and I have also written the management, like make know about the consequences, teach her about the how to deal with the stress and relaxation technique, and make know about the consequences of taking chewing tobacco. Like if you see, if you are going to the community, you will get find that maximum people na, they are taking tobaccos, or they are smoking for their mental relaxation. So they think ki, it will give relaxation from their stress level. So you have to find the main reason of that taking the tobacco, yeah, consuming tobacco, yeah, another any bad habits they are habituating with this. You have to find this. and what is the reason actually. The reason actually you have to find, and you have to focus on this, and tell about the management, and and um, do intervention on this particular reason. Okay, so my family member, who was head of the family, she actually like to chew tobacco. So she said me that she has some mental tension, and chewing tobacco actually give her relaxation. So I have to teach her the relaxation technique, and make her know about the consequences. Then diet is non-vegetarian diet, lifestyle sedentary, can perform our ideals, hobbies no as such hobbies. Medications, you have to write the daily medication she's taking right now. Hygiene, rest and sleep, elimination habit. Then personal medical history, like any childhood disease uh, she has, immunization, allergies. Then family history, health status of family members, physical assessment, weight, blood pressure, vital signs, head to toe examination, hair and scalp, eye, ear, nose and throat, mouth, gum and teeth, history of illness, psychosocial history, like any mental disease, any psychological history. And then if she is having some psychological problem, then who are the supporting system, they will support to cope up with the situation. Stressors, past history of depressing any psychological illness, history of domestic violence, we have to write on this. Then head to toe, then peripheral extremities like skin, sorry, it is head to toe examination, like skin, back and spine, extremities. Then investigation report, BP, RBS. Actually I have just measured her BP and RBS, and the blood report level, and the others investigation reports were not available on that time. So I have just done her BP and RBS, so I have just commented on this. I have just written on this. Then health education given, health education. Then health and okay, there is a there is a problem like, when you are doing home visit na, you only can get one or you only you there is a 5 members in the family, but due to their work, due to their any business issue or work issue, some of the family members may be not available on that time. So you have to write that other family members were not available due to their work at the time of home visits. Because at first you have written key health assessment of every family members. So due to their work, if they are not available now, you have to also read write on this ki they are not available on that time. Not give false information, not write any false information about the other family members. What do you know, just write on this. Then health problem under study, like my patient has hypertension. So I have written on the hypertension, how how it is affecting uh, through the family members, yeah, through the community. Like if I have we have to write about the risk factors, the epidemiology, and yeah, there is a point like you have to compare the risk factors with the book picture and the patient picture, the clinical features with the book picture and the patient picture, diagnostic evaluations, you have to compare with the book picture and the patient picture, complications you have to compare book picture and the patient picture, and then preventions of hypertension, primary prevention. What the primary prevention should be like, you a healthy lifestyle, not to take not to take a lot of salt at the in the food, and also to avoid the oily foods. So this will be the primary prevention. And then family health nursing care plan, like family name, address, setting for care, approach, aim, resources, schedule of contacts, frequency of contact, goal. You should have to write on this, like setting for care, that means it is a family setting, community setting, and health setting. There is no tertiary preventive care is present nearby, so you should write like this. Then approach, how do you go to the family, like just like I have gone with one of my friends, and one of my friend and our teacher. So I have written team approaches, active family involvement. Aim, what should be your aim, like you are doing survey and you have to give health education, how to control the hypertension. You have to write like this. Resources like time and efforts of community health nurse and family, scheduled of contacts, like when the family member is available. Then frequency of contacts, depending frequency of contacts also like the scheduled of contacts, like whenever the family member is available, like this. Then goal like um, goal, it should be like if you are doing any intervention, you should set a goal, like after the intervention the family should get a brief idea about the hypertension, how to control this, how to get a healthy lifestyle. You have to give comment on this, okay. So next there is a nursing diagnosis. Nursing diagnosis is ineffective health maintenance related to lack of regular exercise regimen, risk for non-adherence related to cost of therapy, and acute chest pain is related to difficulty in breathing. Then family nursing problem. Family nursing problem, like as per respective health problems, like inability to recognize risk factor to tobacco consumption due to ignorance of family members and lack of knowledge. They have you have to at first I have told na ki at the medical surgical nursing, we guys focus on the disease condition, but here we will focus about the habits and the environments and everything in the community setting, okay. Then inability to maintain proper waste disposal method due to improper knowledge of disposal method. Then inadequate rest or sleep due to shortness of breath due to hypertension. Then inadequate footwear due to lack of knowledge of our fit condition. Then faulty eating habits due to lack of knowledge and poverty. Then lack of physical activity due to age and obesity. And then hypertension as a health deficit due to improper knowledge in this. So health problems, hypertension is a health deficit. Then the next point is family nursing problem. Then goal and objectives. Then nursing intervention. Then evaluation. And then feedback, that means after the intervention, after doing the whole work, what you are getting from the family members, what the feedback you are getting from the family member. So I have written the three family nursing problems: unhealthy lifestyle and personal habits, especially gutka tobacco consumer. And the next one is health threat, improper garbage and waste disposal method. And lastly, conclusion, and also we have to write the self evaluation, strength points and the barrier points, and at last it is reference, and it is the last page of the community health nursing. So that is what I have discussed with the whole two videos. And these points you have to mention in your community health nursing care plan, case study actually. uh, it was the overview of the case study. You can write also the other points according to your college demands, according to your college requirement demands. So it is our college requirement demand, so I have written these points. If you have another any demand, so you can write. But more or less it is same throughout every colleges. So that's it. That is the video at last. And thank you so much. Bye.